Hello, we are honored to present the wisdom and practice of yoga for your specific interest. And we are grateful to Health Smart Foundation for sponsoring this program. The main objective of Health Smart Foundation is to promote education in the arts, music, health, and human values. Please watch the entire program a couple of times and then begin with the easier practices first. And please review and follow the practice hints and contraindications chart included in this program. Happy viewing and happy learning. Thank you and good luck. Now meet Anjali Kumar, a musician and yoga teacher. She will demonstrate the yoga techniques included in this video program. This program is designed to improve your ability and capacity as a musician. Whether you are a vocalist or an instrumentalist, yoga practice can make you more flexible and allow you to sit, stand, or move comfortably, deepen your breathing capacity to increase your stamina and stability, and calm your mind to help you concentrate and become more creative. Practice the techniques demonstrated and explained on this video and enjoy your music. We will begin this program with physical postures or asanas. Starting with basic stretching and rotations for the muscles and bones. First, knee rotation, Janu Chakra. Placing hands on the knees, rotate clockwise a few times and in the opposite direction a few times. Then hip rotation or Kati Chakra, pushing your pelvis forward, moving clockwise a few rounds. And a few rounds in the opposite direction. Next is fist clenching, moving the arms diagonally and open and close fist. Then wrist rotation. A few times in each direction. Followed by elbow bending, Kehuni Naman. Arms in front, open and close. Inhale out, exhale in. And then elbow bending sideways. Inhale out, exhale in. Then shoulder rotation. Elbows in front of the chest. Inhale, moving up and out. Exhale, down and front. A few rounds. Then a few rounds in the opposite direction. Then hand movement. Inhale up, exhale down, inhale out, exhale in. Inhale left, exhale right, inhale left and up, exhale right and down. Inhale right and up, exhale left and down. And repeat another round. Release the hands, placing the hands on the hips. For neck movement, drop the head in front with exhalation. Inhale up, exhale down, and repeat. Now rotating the neck, turning your left clockwise. Inhale going left and up, exhale going right and down, and then switch to the other direction. Inhale going right and up, exhale going left and down. Continue a few more rounds. Then come to a seated position for a few more stretches. First, rock a baby. Extend the left leg in front and hold the right leg between the elbows and swing from side to side. Then rowing the boat on the same leg, using the same leg. Inhale, going forward. Exhale, coming back and up. Then crank the right ankle a few times in each direction. Then half butterfly. Place the right foot on the left thigh, pull the knee up and push down. And now we will repeat these stretches on the opposite leg. So hold the left leg between the elbows and swing from side to side. Then row your boat. Inhale going forward, exhale coming back and up. Then crank the left ankle a few times in both directions. Then half butterfly with the left leg. Pull the knee up and push down a few times. Shake the leg to see how light and flexible they feel. Now come to a standing position for a few additional stretches. First is going to be the palm tree pose or Tadasana. Join the palms, interlock the fingers, palms facing up. Inhale to rise on your toes. Exhale down, inhale up, exhale down and repeat. Now swaying palm tree pose, Tiryak Tadasana. Sway from side to side, joining the palms together above the head. Arms are straight. Now we'll do a dynamic warm-up, which is the most complete set of exercises for the whole body and all physiological systems. And that is sun salutation, coming toward the front of the mat. Surya Namaskar, sun salutation. We'll do in two stages, one with detailed instructions and then with breath coordination. Step number 1, join the palms in front of the chest. Number 2, stretch out and up, bend back. Step number 3, bend forward and down from the hips. Number 4, extend the left leg far back, looking up. Number 5, right foot next to the left. Number 6, knees, chest and chin on the floor. Then straighten out, bringing forehead on the floor. Number 7, roll up and up. Number 8, in the mountain pose. Number 9, left foot forward. Number 10, right foot forward. Number 11, stretch out and up and lean back. And number 12, come back to the starting position. Now next round is with breath coordination. So starting with step number 1, palms in front of the chest, join together, exhale, inhale for step number 2. Number 3, exhale. Number 4, inhale. Step number 5, exhale. Hold the exhalation for the next step, number 6. Step number 7, inhale. Step number 8, now exhale. 9, inhale. 10, exhale. 11, inhale. And 12, exhale. Now sit down and relax. Feel the increased level and improved flow of energy in the whole body. It's good to do yoga at a comfortable pace without straining yourself or without getting tired and exhausted. Now sitting in the thunderbolt pose, Vajrasana, contraindicated for knee injury and prolapse. Keep awareness at the navel. Hands on the knees or on the thighs. Next is cat stretch or Marjari Asana. Palms on the floor, flat in front of the knees. Exhale to round the back, pulling the navel to the abdomen. Inhale to straighten out, looking up. Repeat a few times. On your own, you can repeat these stretches as many times as you enjoy or feel comfortable with. We can add balancing to cat stretch. So extend the right arm and left leg. Remain balanced and stable without shaking. Harmonize your muscles. Now in the opposite side, in straight line, balanced and stable. Return to the Thunderbolt pose, Vajrasana, preparing for the Lion pose or Simhasana. So, to begin with, bring your knees slightly apart, place your palms on the floor, fingers pointing in. Take a deep breath. As you exhale, open the mouth wide, stick the tongue out and make a growling sound like a lion. Okay, now begin. Take a deep breath in. And as you exhale, open the mouth wide and stick the tongue out and make a growling sound. Returning to Vajrasana, relax for a moment. Preparing for the camel pose or Ushtrasana. So first you will rise on your knees, place your hands on the hips, push the pelvis forward, lean back and drop one hand at a time on the heel. Then drop the head. Continue to breathe. Contraindicated for back injuries and hyperthyroid. Awareness at the base of the throat. Returning to Vajrasana, Thunderbolt pose. Next is baby pose or Shishu Asana. So bend forward and down, bringing forehead on the floor, arms beside the body, palms facing up near the heels. To rise, hold the right wrist with left hand and inhale to come up. Release the hands and relax for a moment. Turn around facing the other side for spinal rock and roll. Round your back, bring the nose between the knees, wrap your arms around the shins. You will exhale to roll down and inhale to roll back up a few times. Now stay down this round, keeping the knees close to the chest. Now you will roll from side to side without lifting the head off the floor and turning the head with the rest of the body. So left, right, repeat a few times. This is contraindicated for serious back problems. And now relax in the corpse pose, feet about 18 inches apart, hands about 12 inches from the body, neck and lower back straight, the whole body completely relaxed. Relax the breath and completely let go. Good idea to relax in the corpse pose after 10-15 minutes of physical postures. Now next is cradling the legs. So bring the feet together, place the left foot on the right knee, hold the right shin with both hands, pull the right knee close to the center of the chest. Feel the stretch in both legs. Maintain a gentle pull on the right knee. And whatever you do with one side of the body, you will do with the other. So now we are going to release out of this and switch to the other leg. So place the right foot on the left knee, hold the left shin with both hands, pulling gently the left knee toward the center of the chest. Feel the stretch in both legs. Now release, relax, and prepare for the wind release pose or Pavan Muktasana. So bringing the right knee close to the center of the chest, pulling with both hands. Inhale to lift the head and bring the nose toward the right knee, or touching the right knee. Then lower the head, release the leg, and bring the left knee close to the center of the chest, pulling with both hands, interlocking the fingers. Inhale to lift the head, bring the nose toward or to touch the left knee. Continue to breathe normally. Then come out of it, release the leg. And now we are going to bring both knees to the chest. Wrap your arms around elbow to elbow. And with inhalation, lift the head and bring the nose between the knees. Continue to breathe normally. Feel this tight squeeze at the both sides of the lower abdomen. This is great detoxifying posture, contraindicated for blood pressure, slip disc, etc. Awareness should be at the navel. Pavan Muktasana is a very effective detoxification exercises for the health of the abdominal organs. So you may repeat if you like. First on the right leg, feel the squeeze in the right lower abdomen. Good for colon health. The ascending colon. Good practice for internal cleansing, removing excess wind and gases, toxins from the body. Then on the opposite side, then with both knees together. Good for the stomach, pancreas, liver, intestines, everything. Continue to breathe. Attention at the navel. Then gently lower the head, release the legs, and relax. correct breathing in yoga is very important. For diaphragmatic breathing, which is deeper breathing, this posture is the best training for that, called crocodile pose or Makar Asana, resting your face between the palms, elbows on the floor in front of the chest, pushing the floor as you inhale. Your navel will press against the floor as you inhale. Keep awareness at the navel. Now the cobra pose, Bhujang Asana, hands directly under the shoulders, feet closer together, forehead on the floor. Inhale to roll up the forehead, nose and chin. Chin about 10 inches from the floor without pressing too much pressure on the hands, looking up. And now pushing on the hands, you can go up higher if you like, if it is comfortable. Okay, try and push on the palms and rise, looking up. Feel the expansion in the lungs, stretch in the throat, and gently come down with exhalation. Bring forehead on the floor. Release the arms beside the body, rest on the left cheek, and then turn to the right cheek. This posture is contraindicated for ulcer, hernia, and hyperthyroid. Next, preparing for the locust poses, Salabh Asana. First, half locust, palms under the pelvis, facing up. Inhale to lift the right leg up. Continue to breathe. Keep awareness at the lower back. This is contraindicated for ulcer, hernia, and thyroid, hyperthyroid as well. Exhale to lower the leg. And now switch to the other side. Inhale to lift the left leg. Continue to breathe. Attention at the lower back. Then slowly lower down. And now both legs together. First exhale. Inhale to lift both legs together off the floor, keeping the attention at the lower back. Continue to breathe. When it gets uncomfortable, you must always come out of a posture. So now gently release. Release the hands, rest on the left cheek, and turn to the other cheek. Now next is the bow pose or Dhanurasana, which is contraindicated for heart disease, high blood pressure, ulcer, hernia, colitis, and pregnancy. So bringing forehead on the floor, grab the ankles with both hands, and first exhale with inhalation, lifting the knees and head off the floor, looking up, attention at the arch in the spine or at the navel. Continue to breathe. You can release out of it whenever you like. Slowly coming out, lowering the head, knees. Then release the feet and rest on the left cheek. And then turn to the right cheek. Next series of postures we are going to do is forward bends. So before that, first relax for a moment after the backward bends. And then turn to your left, come to seated position, facing forward. For head to knee pose or Janu Sirshasana. So first stabilize the breath, relax the body, then extend the right leg in front, left heel close to the groin. Inhale to stretch out and up, pushing up with exhalation, bending forward from the hips, bringing the nose on or toward the right knee, hands on the toes or the ankle, wherever you can reach. There is no challenge, there is no competition. You must respect your own physical condition, limitations, and work according to that. Then inhale to stretch out and up, and exhale to release the hands. And now to the other side, right heel close to the groin, left legs out, inhale, stretch up, push up with exhalation, bend forward and down, bringing the head on or toward the left knee. Relax the body, allow the gravity to pull you down. For all the forward bends, you must be careful if you have slip disc or sciatica. Now full forward bend, both legs out in front, hands beside the body. Inhale to stretch out and up, pushing up. With exhalation, bending forward from the hips, keeping the back as straight as possible. Bring the nose or forehead between the knees or as close to the knees as possible. Relax the abdomen, relax the back. That will allow you to achieve a better posture in this full forward bend, Paschimottanasana. Before coming up, first fully exhale, then with inhalation, stretch out and up, and with exhalation, lower the hands. And relax. Then simple spinal twist or Meru Vakra Asana. So in this you will be turning to your right, placing the right hand behind the back, left hand on the right side of the right thigh. Twist to your right, look back. Then gently release and twist to the other side. Bring left hand on the floor behind the back, right hand on the left side of the left thigh. Twist to your left and look back. Contraindicated for back conditions, ulcer, hernia, awareness at the navel. Now release out of the posture and come to a reclining position facing up. We'll prepare for shoulder stand after the corpse pose. Now shoulder stand is contraindicated for hyperthyroid, cervical spondylitis, slip disc, hypertension, eye disease, menstruation and pregnancy. And the instruction is that you are going to bring the feet together, hands beside the body, palms down. You are going to inhale to lift the legs, exhale to fold over, and inhale to straighten up. So when you are ready, you can begin. Now, bring the feet together, hands beside the body, palms down. Inhale to lift Exhale to fold over. Inhale to straighten up, bringing the hands at the lower back for support. Body is upright in an inverted posture. Chest is close to the chin. Keep awareness at the base of the throat. Do not swallow, cough, or sneeze or talk in this posture. You can hold as long as possible, maybe 2 or 3 or 4 minutes. When you are ready to come out, with exhalation, you are going to lower the legs overhead. With inhalation, roll down the spine, and with exhalation, lower the legs on the floor. So, whenever you are ready, lower the legs with exhalation, roll out with inhalation, and lower the legs with exhalation, and relax in the corpse pose. Always a good idea to relax in the corpse pose, especially after shoulder stand, for about half the duration that you were in shoulder stand. So if you're doing shoulder stand for 4 minutes, you must relax for about 2 minutes in corpse pose. You must also do the fish pose after shoulder stand. Fish pose is the counter pose to shoulder stand. For that, you're going to put your feet together, inhale to rise to a half-seated position, and then lower the top of the head to the floor. So when you are ready, we can begin. Feet together. Inhale to lift up halfway and resting on the elbows, lower the top of the head to the floor. The throat is stretched in the opposite direction. Chest is expanded, also improving your posture of the body. Contraindicated for heart disease, menstruation, pregnancy, hernia, and back problems. When you are ready to come out, you will inhale to lift up and roll down and relax. So prepare to come out of the posture now. Inhale to lift up to half-seated position, resting on the elbows. Okay, coming out of the posture. And roll down. Relax in the corpse pose again. Now we'll practice quick corpse pose, Shighra Savasana. So you are going to take a deep breath in, tighten all the muscles of the body, lift both arms and legs and head, and hold the breath and the tightness, squeeze. And then when I say release, you are going to release or drop arms and legs on the floor and slowly lower the head. So now prepare for quick corpse pose. So take a deep breath in, tighten all the muscles of the body, lift both arms and legs, hold the breath and the squeeze tight. And when I say release, you are going to drop the arms and legs and slowly lower the head to the floor. So now do it on your own 2 times. This is 1. Hold only as long as is comfortable. And release. Repeat 1 more time. Release. Toward the end of physical postures, good idea to do yogic pose or yog mudrasana. So in a seated position, stabilize the body and the breath first. Totally relaxed. Bring the hands behind the back. Hold the right wrist with left hand. With exhalation, bend forward and down, bringing the forehead on or toward the floor. Relax the abdomen and the lower back. This posture gives a very deepening experience, inner experience. You can hold this posture for a few minutes. Before coming up, first fully exhale, and with the slowest possible inhalation in the same breath, lift the head gently to straighten the spine, and you're going to be coming up to an upright position. Now, exhale fully, and with slowest possible inhalation, lift the head, straighten the back, and slowly come up. Return the hands on the knees and experience the deep relaxation after yogic pose, Yog Mudrasana. This is a meditative experience. Now, eye movements, Netra Vyayam. So, in a comfortable seated position, first rub the palms together, make it hot, cup the eyes to transfer the heat to the eyes, eyelids, and relax. Next is blinking. Open and close the eyes quickly and relax. Next, focusing, right index finger in front of the face, about 6 inches away, left index finger further 6 inches behind it. And shift your gaze from the right index finger to the left, then to a point further away on the wall, and keep shifting back and forth. to improve the focus of the eyes. Right finger, left finger, point on the wall, and then return the hands on the knees, relax the eyes. Next is peripheral viewing, both index fingers in front. Look at a point between the two fingers, fixing your gaze there. Split the fingers apart, moving sideways, still being aware of the fingers moving away at the periphery. Then bringing them back. Release the hands. Now, horizontal viewing. Right index finger in front without turning the head. Move the hand to the right and horizontally back to the left. Only eyes move, the head does not. Release the hand on the knee. Next is vertical viewing. Bring the right index finger on the floor in front of you. Look at the tip of the finger without turning the head. Bring the arm straight up toward the ceiling vertically. In all eye movements, you must remove contact lenses if you are wearing one, and eyeglasses, and avoid eye movements if you had recent eye surgery. Next is diagonal viewing. So right index finger on the upper right corner, moving diagonally across to the lower left without moving the head, without turning the head. Only eyes are following the index finger. And using the left hand, you'll do diagonal viewing in the opposite side. From upper left corner, moving diagonally across to the lower right. Release the hand, relax. Next is rotational viewing. Imagine a big clock in front of the face and looking at 12 o'clock, moving clockwise slowly, touching all the points in the periphery. And when you return to 12 o'clock again, switch to the opposite direction, counterclockwise, making a circle. Then center the eyes and close the eyes, relax. And at the end of eye movements, rub the palms together again. Transfer the warmth to the eyelids, eye muscles, and relax. Next is breathing exercises or pranayama, starting with breath awareness or shwas dharana. Hands on the knees, making a circle with the index fingers and thumbs. Observe the breath, observe its gentle flow in and out of the nostrils. Feel the coolness of inhalation and the warmth of exhalation. Keep the abdomen soft, chest relaxed. Breathe slowly and deeply. Feel the positive energy and life force entering the body with each inhalation, and all the toxins and negativity being expelled with each exhalation. Feel the connectedness between the inside and the outside of your being. Keep awareness at the navel. Experience the turning points between the breath when exhalation turns to inhalation and inhalation turns to exhalation. Just watch the breath, the window to the mind, and beyond the mind to the core of your being. Then extended breath diaphragmatically, Dirgha Swas or Yogic breath. So in three parts, abdomen, chest, and above the chest. Inhale first deeply, pushing down the diaphragm, expanding the abdomen, and continue to inhale, allowing the chest to expand and then the collarbone to rise slightly. Good. As you begin to exhale, relax the collarbones and the chest and contract the abdomen all the way toward the spine. And repeat a few times the extended breath, which is a good practice in deep breathing. Not only increases the quantity of breath, oxygen in the body, but increases the level of energy many, many times more than the amount of breathing. So if your breath quantitatively increases 4 to 5 times the average breath, the level of energy in fact increases 30 to 40 times. Breath is also the connection between body and mind. Next is going to be skull shining breath, Kapalabhati, which consists of forceful exhalation, contracting the abdomen, and releasing the abdomen for a passive inhalation. This is contraindicated for high blood pressure, hernia, ulcer, epilepsy. Now we are going to do the Nadi Shuddhi or nerve purification, also called alternate nostril breathing, which balances, harmonizes the body, breath and mind, level of energy on both sides. So roll in the index and middle finger, and using the thumb and ring finger, you'll practice this. Close the right nostril, exhale from the left, then inhale from the left, then close left, exhale from right, inhale from right, then close right, and continue at your own pace. Breath is moving softly and smoothly. It's very relaxing practice, great stress reliever, calming the mind, When you are ready to stop, after exhalation from the right nostril. So you begin this practice with exhalation from the left and end after exhalation from the right. You can stop on your own when you are ready. And then return the hand on the knee. Next is humming breath or Brahmari, which is contraindicated for ear infection. So you're going to plug the ears with the thumbs and place the other fingers on the head. And with exhalation, produce a humming sound like a bee, which will vibrate in the skull and soothe and calm down the brain and the mind. So begin whenever you're ready in the breathing technique called Brahmari or humming breath. So ears are plugged. You can stop. Internal cleansing, Jalaneti, with using the pot and warm water. Body temperature, not too hot, not too cold for the nostrils. And this pot is especially designed for this practice. So first fill the glass with the prepared water. To further disinfect and to maintain the internal environment of the nostrils, which is saline and warm. Mix a pinch of salt, about quarter teaspoonful for this amount of water. Pour the water into the pot. Equal weight on both legs. Calm. Now leaning forward, tilting the head to the left, and breathe through the mouth. Bring the nozzle into the right nostril without pushing or forcing. As you tilt the pot up, water will go in the right nostril and come out the left. Continue to breathe through the mouth. This is contraindicated if you have bleeding nose. When you are done, return the pot and wipe the nose. Now we'll repeat the procedure on the opposite side. So pour in the water first in the glass and mix a little bit of salt. Then mix the salt in the water. Pour the water into the pot. Holding the pot in the left hand, lean forward and down. Tilt the head to your right and put the nozzle into the left nostril without forcing or pushing. You have to be gentle. Breathe through the mouth. Tilt the pot up to allow the water to go in the left nostril and come out the right nostril. This nasal cleansing with water also prevents allergies, cold, asthma, and other respiratory problems. When you are done, return the pot and wipe the nose. Now to remove the remaining droplets of water from the nostrils, you'll do forceful exhalation through one nostril at a time. First, close the right and exhale forcefully through the left. Now close the left and exhale forcefully through the right. Now place the hands on the knees and exhale forcefully through both nostrils. Wipe off the face, relax and enjoy the clean, refreshing experience of the body, the breath and the mind. Now the practice of Dhyana or relaxation and meditation. For musicians, the experience of inner silence, antarman meditation technique is particularly beneficial. So, in a meditative seated position, keeping the eyes closed, relaxing the body, making a circle with the index finger and thumb, focus awareness on the breath and observe its soft rhythmic flow. Begin to observe the gentle hissing sound of breath in the throat. Relaxing the throat completely, the tongue and the eyes are also relaxed. And observe that the breath is becoming quieter and quieter, softer, until you can no longer hear the sound of breathing. Gradually become aware of the silence everywhere in the body, the breath, and the mind. Sink deeper into the inner silence. If any thoughts arise, let them come and go without paying attention, without getting involved. Enjoy the peaceful silence for a few minutes, because the music is born out of silence. The silence between the sounds, between the notes, is what defines the deeper meaning of music. Sink deeper into the silence. To come out of this meditation, deepen the breath, rub the palms together, and transfer the warmth to the eyes without pressing too hard. Gently massage the temples, face, neck, and shoulders. Good luck with your practice and enjoyment of music.